Welcome to a crash course on shoulder and arm anatomy. So to begin with, let's have this guy on the anatomical position. And then we'll be proceeding to make the circular incisions through the skin of the brachium, antebrachium, wrist, and about 5 cm distal to the wrist as illustrated. Then, to be joined with a longitudinal incision along the anterior aspect of the upper limb. Remove the skin, careful to leave the important structures we'll be identifying. We'll first be IDing the cephalic vein, which can be seen coursing from the dorsal venous arch to the dorsum of the hand to the posterior lateral side of the forearm. Showing the basilic and medial cubital vein. From this view, we'll be able to appreciate the coursing of the cephalic vein. Here, we can also identify the dorsal venous arch. Going back to the forearm, we'll be able to ID the musculocutaneous nerve originating from the C5 to C7 of the brachial plexus, also showing other structures of the upper limb. Zooming in on the hand, we'll be able to appreciate the palmar branch of the median nerve C6 to C8 and the median nerve itself, the palmar branch of the ulnar nerve, as well as the superficial branch of the radial nerve. Focusing on the deltoid, we'll be able to appreciate the superior lateral cutaneous nerve of the arm emerging beneath the deltoid, as well as the posterior cutaneous nerve of the arm. The inferior lateral cutaneous nerve, as well as the posterior antebrachial cutaneous nerve, both originating from the radial nerve. Going back to the hand's dorsum, let's identify the dorsal digital nerves of the radial nerve, the superficial branch of the radial nerve, as well as the dorsal digital nerves of the ulnar nerves. Incising and removing the layer of the deltoid and platysma, we'll be able to expose the scapula, its glenoid, and its associated structures. Exposing the supraspinatus muscle, which is responsible for the abduction and stabilization of the arm at the glenohumeral joint. Next, we'll be IDing the pectoralis major and minor, which together are responsible for the various motions of the shoulder joint and girdle. Also showing the teres major, latissimus dorsi, and subscapularis muscle, which are responsible for the adduction, medial rotation, and extension of the shoulder joint. Now, to better appreciate the subscapularis muscle, we'll be isolating it. This axioscapular group of muscles will be responsible for the retraction and downward rotation of your pectoral girdle. These muscles include your levator scapulae and your rhomboid muscles. Isolating the infraspinatus muscle, we'll be able to see how this muscle, along with others, contribute to the following motions: abduction and lateral rotation. Isolating yet again the rhomboid muscles, show how it adducts the scapula along with other muscles, which includes the trapezius and latissimus dorsi. Using forceps, let's identify the structures derived from the brachial plexus. The dorsal scapular nerve from the brachial plexus's C5 root supplying the axioscapular nerves. Also showing our suprascapular nerve from the superior trunk. Incising a portion of the lateral head of the triceps brachii will expose several structures that include the radial nerve accompanied by the deep artery of the arm. Cutting away portions of the infraspinatus and supraspinatus muscle will expose the suprascapular nerve and artery that courses inferiorly to the suprascapular ligament to enter the supraspinatus fossa. This nerve is from the superior trunk of your brachial plexus. This will supply the sensory innervation to the glenohumeral and acromioclavicular joint and motor innervations to your infraspinatus and supraspinatus muscles. Showing again the origin of the suprascapular nerve arising from the superior trunk of the brachial plexus and the suprascapular artery from your thyrocervical trunk of the subclavian artery. And here we'll be seeing how the pectoralis minor, along with the serratus anterior, abducts the shoulder. It also contributes to the depression of the shoulder. Other muscles include trapezius, latissimus dorsi, and pectoralis major muscle. The pectoralis major is innervated by two nerves, the lateral pectoral nerve and medial pectoral nerve. Its insertion is on the crest of the greater tubercle of the humerus. This muscle contributes to various motions of the upper limb that include medial rotation of the arm, shoulder flexion, shoulder depression, and shoulder adduction. Now, before I end my portion of the discussion, let's take a sneak peek of the brachial plexus, which is going to be reported by my colleague. The brachial plexus, by the way, is a network of nerves. This plexus extends from the spinal cord through the cervico-axillary canal in the neck, over the first rib, and into the armpit. That's all for now. Thank you.